Welcome to Week 5 of Community Health Nursing. This week focuses on vulnerable populations, violence as a public health issue, and community aggregates. For example, instead of focusing on one individual experiencing violence, community health nursing examines how violence affects entire families, neighborhoods, or age groups, and what can be done to prevent harm and improve health outcomes at the population level. This lecture includes discussion of vulnerable populations, violence, abuse, and the public health effects of trauma. For example, when violence is discussed, the focus will be on patterns, risk factors, prevention strategies, and nursing roles, rather than graphic details or individual stories. Students are encouraged to care for themselves and access support resources as needed. The purpose of this lecture is to strengthen your ability to provide safe, trauma-informed, and compassionate care as a nurse. By the end of this lecture, you should be able to define community aggregates, identify vulnerable and at-risk populations, explain violence as a public health issue, apply the nursing process to community-level care, describe the nurse's role in prevention, advocacy, and trauma-informed care. Vulnerability refers to an increased risk for poor health outcomes due to individual and social factors. Individual factors may include age or pre-existing illness. Social factors include education, employment, housing, and access to health care. Vulnerability increases the risk for health disparities, particularly among marginalized populations. For example, an older adult with limited income and no transportation may delay medical care. A child living in unsafe housing may have worsening asthma. An adult working multiple jobs may skip preventive care due to time and cost barriers. In each case, vulnerability results from external conditions, not personal failure. Health disparities are differences in health outcomes that occur among specific populations. These disparities are often linked to socioeconomic status, discrimination, and unequal access to care. Community health nurses work to identify and reduce health disparities through advocacy, prevention, and population-focused interventions. For example, communities with lower income often have higher rates of chronic disease. Marginalized racial and ethnic groups may experience higher maternal mortality rates. Rural populations may have reduced access to primary care. These disparities exist because of inequitable access to resources, education, and healthcare, not biological differences. Social determinants of health are conditions in which people live, learn, work, and age that affect health outcomes. Key determinants include education, income, housing, employment, and access to healthcare. Socioeconomic status is one of the strongest contributors to health inequities and disparities. For example, children attending underfunded schools may lack school nurses or mental health support. Families living in food deserts may rely on unhealthy food options. Individuals without insurance may use emergency departments instead of preventive care. These determinants shape health outcomes across the lifespan. Populations at increased risk include children and adolescents, older adults, individuals experiencing homelessness, incarcerated individuals, rural and migrant populations, LGBTQIA+ individuals, veterans. These populations experience higher rates of illness due to systemic and social barriers. For example, individuals experiencing homelessness have higher rates of infectious disease. Rural populations may lack access to specialty care. LGBTQIA+ individuals may avoid care due to past discrimination. Veterans may experience PTSD or substance use disorders. These risks are driven by social and structural factors, not individual choices. An aggregate is a group of individuals who share one or more common characteristics. These characteristics may include age, geographic location, health condition, or social experience. In community health nursing, the aggregate is the client, allowing nurses to address health needs at the population level. For example, adolescents exposed to community violence, older adults living alone, families in low-income housing, or migrant workers exposed to hazardous conditions. In community health nursing, the aggregate is the client, allowing nurses to identify trends and plan population-focused interventions. Children and adolescents are vulnerable due to dependence on caregivers, environmental factors, and adverse childhood experiences, also known as ACEs. Exposure to abuse, neglect, or household challenges can cause toxic stress and long-term health consequences. Nurses focus on prevention, early identification, and family-centered support. For example, children exposed to domestic violence may experience anxiety or poor academic performance. Adolescents without supervision may engage in risky behaviors. Children with multiple adverse childhood experiences may develop long-term health conditions. Community nurses focus on prevention, early identification, and family-centered support. Adults may experience vulnerability related to chronic illness, mental health conditions, economic stress, and caregiver role strain. Health disparities among adults are often linked to discrimination, access to care, and social determinants of health. Nursing interventions emphasize health promotion, screening, and access to resources. For example, adults managing chronic illness while working multiple jobs may miss appointments. Caregivers may experience stress and burnout. Adults may delay mental health care due to stigma or cost. Nursing interventions emphasize health promotion, screening, education, and access to resources. Older adults face increased risks related to chronic illness, social isolation, neglect, and abuse. They may also experience barriers to accessing healthcare and support services. Community health nurses promote independence, safety, and early recognition of health concerns. For example, an older adult living alone may experience social isolation. Limited transportation may prevent access to care. Cognitive decline may increase risk for neglect or abuse. Community health nurses promote safety, independence, preventive care, and early intervention. Families are considered an aggregate because health behaviors and stressors often affect all members. Family health may be influenced by financial strain, illness, role changes, or violence. Nurses assess family strengths, risks, and resources to promote resilience and stability. For example, financial strain due to unemployment may increase stress, impact nutrition, and limit access to care. Chronic illness in one family member may affect roles and responsibilities. Exposure to violence can affect both adults and children. Nurses assess family strengths and resources to support resilience and stability. Violence is a major public health issue due to its widespread impact on physical health, mental health, and community well-being. It contributes to long-term health disparities and affects individuals across the lifespan. Public health efforts focus on prevention and early intervention. For example, communities with high violence rates often experience increased emergency department use, long-term mental health effects, and economic strain. Public health approaches focus on prevention, early identification, and addressing root causes, rather than responding only after harm occurs. Violence occurs in many forms. Types of violence include child abuse and neglect, intimate partner violence, elder abuse, sexual violence, human trafficking, youth and community violence. Understanding these forms helps nurses recognize risk and respond appropriately. For example, child neglect may lead to missed medical care. Intimate partner violence may cause chronic stress or injury. Elder abuse may involve neglect or financial exploitation. Youth violence may disrupt education and community safety. Each type requires specific prevention and intervention strategies. Violence is influenced by factors such as poverty and unemployment, substance use, social isolation, exposure to violence, lack of community resources. For example, poverty can limit access to safe housing. Substance use may increase risk for aggression. Social isolation can reduce support systems. Communities lacking youth programs may see increased violence. These factors are closely linked to social determinants of health. Nurses play a key role in recognizing potential indicators of abuse. Signs may include unexplained injuries, fearfulness, withdrawal, or unmet basic needs. For example, repeated unexplained injuries, fearful behavior, withdrawal, poor hygiene, or unmet medical needs may indicate abuse or neglect. Assessment should always be non-judgmental, respectful, and focused on safety. Nurses are mandated reporters for child abuse and elder abuse, according to state law. For example, suspected child abuse must be reported to Child Protective Services, and suspected elder abuse must be reported to Adult Protective Services. Intimate partner violence may not always require reporting, but nurses must still provide support, safety assessment, and referrals while following state law. Violence prevention occurs at 3 levels. Primary prevention aims to prevent violence before it occurs. Secondary prevention focuses on early identification and intervention. Tertiary prevention works to reduce long-term effects and prevent recurrence. Primary prevention includes education on healthy relationships, parenting programs, and policies addressing poverty and housing. Secondary prevention includes screening for abuse, identifying early warning signs, crisis intervention, and safety planning. Tertiary prevention includes counseling, case management, coordination with community agencies, and long-term support. Community health nurses are involved at all three levels. At the community level, the nursing process includes assessing community needs and risks, planning population-focused interventions, implementing collaborative strategies, evaluating outcomes. Assessment may include reviewing violence statistics or conducting windshield surveys. Planning may involve setting goals to reduce risk factors. Implementation may include education, referrals, or outreach programs. Evaluation may involve tracking outcomes or community feedback. This process supports sustainable population health improvement. Trauma-informed care recognizes the impact of trauma and emphasizes safety, trust, collaboration, and empowerment. Culturally sensitive care respects beliefs, traditions, and lived experiences, improving engagement and outcomes. Both are essential to improving health outcomes for vulnerable populations. For example, nurses use non-judgmental language, allow client choice, and avoid re-traumatization. Breaking cycles of violence requires prevention, education, community partnerships, advocacy, and access to support services. Nurses play a critical role in promoting safer environments and healthier communities. Examples include early childhood education, mentorship programs, access to mental health services, substance use treatment, and policy advocacy addressing housing and poverty. Nurses are key advocates in these efforts. To summarize, vulnerability is shaped by social and systemic factors. Health disparities result from unequal access and opportunity. Aggregates allow nurses to address population-level health needs. Violence is a public health issue requiring prevention and advocacy. Trauma-informed, culturally sensitive care is essential. Community health nursing extends beyond the bedside and into the community.